Healthcare in Kent is changing. As the population ages and life expectancy increases, huge financial pressure is starting to be felt on our health and social care services. In response to this, major government reforms are taking powers out of the hands of NHS managers and bureaucrats and into the hands of patients and local GPs. It will allow GPs and local councils to commission the health and social care services their patients need, rather than merely what the system has always provided. The emphasis will be on local decision-making, with Kent County Council playing an important role in ensuring that the health and well-being of the population is improving.
The government's health reform agenda is a massive opportunity to change and transform the way health services are delivered across the country and in Kent. Working alongside frontline practitioners, we've produced a discussion document which begins to shape how primary care services, social care services, community health services could be delivered in the future, that makes much better use of public resource and delivers better health services and better health outcomes for our residents.
So what will be different in future? Well, some new services are already starting to appear. Take, for example, Estuary View in Whitstable. This innovative medical centre offers full GP services and healthcare services normally found only in hospitals, such as diagnostic tests, a day surgery and a minor injuries unit with X-ray facilities, open 7 days a week, 365 days a year.
Well, the principal advantage is to the patient themselves. If most of what they need can be sourced in one place, then their journey through their healthcare is so much more satisfactory. But the other important fact is that there are economies to be had by having everything in one place rather than the patient having multiple appointments with multiple charges.
Well, I think it's a terrific facility. The whole thing works. And I think so little in the health service seems to work these days the way we want it to. And here is an example of the National Health Service actually working, and working effectively for the benefit of the people.
At Folkestone, a new scheme is focusing on helping people to stay well rather than just treating them when they become ill. Proactive care supports individuals and their families with a wraparound neighbourhood clinical team to improve the person's health and well-being.
Pretty good, apart from my accident.
This could mean visits from a community matron to keep an eye on minor problems and prevent them escalating. Results so far have been impressive.
Because older generations could be a lot more in this country and account for a larger proportion of patients in this country, we need to start looking at that journey 10, 15 years before they get to that stage, and where we devote some of our resources. At the moment, we're waiting for them to hit 65, 70 and really build up a whole list of medical conditions before we really become motivated to do things. So in this way, we look at their journey a lot earlier so that we can prolong that normal life for them for a longer period, and then have a much shorter period of ill health. And by that, you have a more productive society, a healthier society, but also less strain on an already overstretched NHS system.
I'm in my own home. I get the treatment in my own home. I don't have to rush to hospital, don't have to visit the doctor every 5 minutes. The main aim, they want to keep us in our own home. We want to be in our own home, and we're going to be.
Another innovative scheme being piloted in Kent is helping to solve the frustration patients experience with disjointed healthcare. Patients who see a number of different health professionals across different services often find that information isn't shared, leading to frustration, delays and wasted resources. Patients Know Best is an online system, one place that has the records from your GP, hospital and others, and best of all, it's a patient-controlled system. It means that the health team supporting a patient can see the bigger picture, intervene earlier to prevent minor problems escalating, and reduce unnecessary hospital admissions.
At the moment, our health and social care information is held on various different systems, and even within the National Health Service, different professionals don't have access to different parts of that person's health record. And by bringing it together into one place, with that person being in control, it enables that information to be shared more widely. It means for the individual that it's much easier for that care to be coordinated. It means that they won't have to repeat information to various other health and social care providers, and it means that everybody can go to one place and see exactly what's going on for them.
At Westview Integrated Care Centre at Tenterden, patients can recover from illness or injury and be kept under observation prior to returning home. It's a much better solution than keeping patients in acute hospital beds. It results in better outcomes for patients and carers and frees up badly needed acute beds. Avoiding unnecessary and expensive hospital admissions is vital to managing the long-term conditions that an ageing population inevitably brings.
I'd like to see intermediate care beds in a lot more community surroundings. We're developing a lot of extra care sheltered housing within Kent, and there are such great options to be able to develop some intermediate care units within there. People can be properly assessed within a home and living environment whilst having 24-hour care on site. Another way of being able to offer choice to the individual rather than the acute hospital setting.
Some people don't really need to go into hospital, but they need some sort of help and treatment, and something like this is much better. And last year I had several falls and was quite ill, and I feel that if I'd had somewhere to come like this last year, probably wouldn't have been here this year. I would have recuperated and learnt how to cope with things better.
Another way to improve the quality of care is to ensure there's a choice of services from a range of providers. Charities and social enterprises such as the British Heart Foundation and the Alzheimer's Society, and private sector organisations such as Saga and Virgin Care are already helping to deliver better outcomes and better value. It's an idea that's already delivering impressive results in Surrey. Here, Virgin Care provide a range of services, including managing community hospitals and minor injury units. These are NHS services, free and accessible to anyone who wants to use them. One innovation is the virtual ward, which brings together GPs, health workers, nurses and social services to share information and ensure patients receive the best quality and most cost-effective care.
Take a seat and tell me how you're feeling.
It is working. No, we're very, very pleased with the model. We've been collecting data on a monthly basis. We've been looking at the unplanned activity prior to the patient being admitted to the virtual ward, during the virtual ward experience, and we want to start gathering more information post to show that it's sustainable. But we've got good evidence to show that the numbers of unplanned care admissions and visits to A&E have much reduced since the virtual ward model's been in progress.
I think this idea of virtual ward is again very, very good. It means obviously that the likes of me don't have to go into hospital every now and again, and with all the trauma that sort of gives. And I think on a cost side it must also be very, very cost effective as opposed to keeping people in hospital all the time. And the lasses that come in to see me, these community matrons, are just a godsend.
We cherish the NHS, but its founding vision is under threat from the huge demographic and technical changes we face in the 21st century. Doing nothing is not an option.
At the moment, the majority of adult social care spend is on care home places. The majority of NHS spend is on the acute sector. If you look at things such as ageing population, increased cost of drugs, if we carry on the way we are at the moment, then we will not have a sustainable adult social care or an NHS. So we have to do things differently. So what we do have to do is to focus on those things that we do together which add the most value. Now, if we get this right, it will deliver better outcomes for patients and citizens, but we will also make the savings that we need to be able to make.
The scandal at Mid Staffordshire NHS Trust shows what happens if we let bureaucracy, form filling and targets get in the way of providing the right care for patients. The need for local leadership in the NHS has never been greater to help us all lead healthier and happier lives.
The case for change is compelling. By working together closely in partnership, we can make much better use of public money. We can deliver integrated community health services that are accessible to our patients 24 hours a day, that really do lead to better healthcare and better health outcomes for our residents.